Sean Rogers struggled for more than 20 years to manage his weight, even as his diabetes kept getting worse.
By just dieting and continuing the cycle with the insulin, I was never going to lose the amount of weight I needed to lose to change the whole cycle and get the diabetes in really good control.
Insulin, which stabilizes blood sugar, can make people feel hungry, making it harder for them to lose weight. But bariatric surgery is expensive. In the U.S., health insurance companies won't pay for the procedure unless a patient's body mass index, or BMI, is at least 35, even if the patient's diabetes is uncontrolled. BMI is a measure of body fat based on height and weight and is not always an indication of how well a patient is responding to treatment for diabetes.
BMI is not really a fair or accurate representation of who should be getting therapy.
Dr. Stacy Bretthauer at Ohio State University says the criteria for the surgery is outdated.
The patient who doesn't get the operation, we know very well that their disease will progress, their lifespan will be shortened if they don't get effective treatment.
The American Medical Association classifies obesity as a complex chronic disease that requires medical attention. Left untreated, obesity can also lead to heart disease, cancer, and diabetes.
No one asks somebody with cancer or heart disease to just do it themselves. They have to participate in their care and do the right things, but there's also effective therapy being offered to those patients at the same time.
Since his surgery, Rogers has lost a significant amount of weight, and his diabetes is under control. He no longer needs oral medication, and his insulin is down from nearly 500 units per day to about 10.
It's changed my life so much I would, have anyone do it.
Diabetes is a global health issue. More than 400 million adults, 1 in 11, have this disease. The World Health Organization estimates that number will rise significantly in the near future. If diabetics have bariatric surgery early on, they can be cured. For those who have had the disease for 10 years or more and need insulin shots, the surgery won't reverse their diabetes, but Bretthauer says it can greatly improve their health. Carol Pearson, VOA News.